My name's Anthony, I'm from Complete Podiatry. I've come here today to talk about diabetes in your feet. So part of the talk today, the first part is going to be just talking about how important feet are for general health and well-being. Then we're going to focus a little bit on how diabetes can affect your feet, and then some simple steps as to how to minimise those potential risks with diabetes as well. No, we've been up in Blackwood now for, it must be about 7-8 years or so.
Oh, right.
Yeah, we're next door to where the old Flight Centre used to be, between Fancy Burger and the old Flight Centre building. Yeah. All right, so titled today's talk is Diabetes in Your Feet. And I'm going to show you how to build an amazing life from the feet up, basically, hopefully. Feel free if you have questions during the talk just to interject. I'd rather have a conversation than to talk at people. So if you have any questions or if you've got anything on the slides that you don't feel I've covered, then just sing out, okay? So a little bit about me. I've been in podiatry for about 25 years now. When I did this slide, it was quite a revelation, thinking, oh my God, 25 years just like that. So I've worked in public health. I started my career back at Flinders Medical Centre for about 7-8 years, and I moved overseas. So I've worked in Australia, UK, Europe, and started Complete Podiatry about 10 years ago now. This is actually our 10th anniversary in 3 months, so that's pretty exciting for us. I love family, I love travel, especially pre-COVID, and I love learning. So this is why I like to do these sorts of talks. It's to share my passion for feet, which is a very strange passion, I understand. But hopefully after today's talk, we'll all understand a bit more about why feet are so important for what we do every day of our lives. So the biggest question people ask me, and the most frequent question I get, is why do you want to work with feet? Because it is a fairly strange passion or calling or whatever you call it. But for me, feet are super important. You know, every day I come to work and do this, which is very strange for a lot of people, but it's not so much the feet that I really love, it's working with people. And every day we have the opportunity to help someone get a little bit better, do a bit more, get stronger, stay active, keep healthy, all just by looking at someone's feet and helping them from the feet up, basically. You know, your feet are amazing. We don't often think about them because every day we get up, we go to the gym, we go out, we socialise, we work, we look after grandkids, and every day the feet just keep doing what they do. So they're an amazing bit of engineering, they're amazing things that just keep going most of the time until something goes wrong, and then you realise how important they really, really are. So just to talk a little bit about your feet, there's 26 bones in the feet, 33 joints, 19 muscles, 10 tendons, 107 ligaments. There's a lot going on down here. You know, when you look at the anatomy pictures of like this, you sort of think, wow, there are so many things happening in the feet. So each one of these things, there's a potential for something to go wrong there. And if it's a ligament strain or a muscle strain or tendon damage or the nerves are being stressed, all of these things have a direct function on how well that, or have a direct effect on how well that foot as a unit can function. So as podiatrists, we're specially trained to understand the complex interplay of all of these structures and how they allow the foot to function. So the average person walks about 170,000 kilometres in a lifetime, and that's the average person. You know, there are other people whose job involve lots of walking, or if you're really fit and active, you're going to do more than that. But just to put that into... Yeah, it builds up, doesn't it? Yeah. Just to put that in context, because for me, 170,000, it's a big number, but you know, I don't really get what that number really means. The circumference of the globe, of the Earth, is 40,000 kilometres. So that's like going around the planet 2, 3, 4 times in your lifetime. It'll probably take me a lifetime to walk around the planet 4 times, but that's a long, long way. And that's a lot of force and a lot of stress that you're going to have on your feet. So feet are pretty amazing that they can do that. Every day, your feet carry about 200 tonnes. Now that's gravity pushing your body weight into the ground, basically. And every step, that's so many kilos, then so many kilos, then so many kilos. And that adds up every day to 200 tonnes, which is the equivalent of a blue whale. So imagine you're shifting a blue whale every single day, and that's the load that's going through your feet. So all of those tendons, ligaments, muscles and joints are dealing with this much force every single day throughout every day of your life, which to me, that's pretty amazing again. So, and unfortunately, women are spelling mistake. That's the first time I've picked that one. Arr, sounding like I'm a pirate today, so. Yeah, I know. So women are 4 times more likely to have foot problems than men. We men are very lucky because our shoes are generous, they've got lots of cushioning, they're not so much dictated by fashion. Women's footwear has always been dictated by fashion, unfortunately. Women tend to spend a lot of time on their feet looking after children. So unfortunately, there are a lot of factors that mean women are more at risk of having foot problems. And there are a lot of hormonal factors, biomechanical factors, and other reasons as well for that. But it just means that women tend to get more problems. And I like this photo because it just shows putting your foot into a pair of high heel shoes drastically changes the way they walk. There's no way I'd ever want to wear a pair of shoes like that. Just that would hurt. I don't know how people can manage with that, but fashion is a funny beast. So why feet again? It's not so much the touching of feet or anything like that. It's what feet let us do. You know, you think about all the things you do through your life and think about that from a point of view as, if I couldn't use my feet, how would my life be different now? And that's the big thing for us as podiatrists. It's about how can we help people do all the things they want to do without their feet impacting on them and still allow them to do all the wonderful things they do. You know, whether you're a hiker, whether you've got grandkids, whether you just want to stay fit and healthy, all of these things are really important for you as a general person. And if your feet aren't working properly, all of these things become hard. And that just reduces quality of life. It reduces your ability to be social, to interact with people, and that has a major effect on your general health and well-being moving forward. So your feet, normally they're just packed away in a pair of socks and shoes, but really we have to think of them a little bit more than that because they're so important for everything that we do during the day. So this little pair of feet that's born, you think, wow, the future potential of your feet from this stage onwards is fairly amazing. So diabetes is a big condition. I don't know, I'm not going to ask if anyone here has diabetes, that's for you, but diabetes has the potential to cause major changes in the feet. So what we're going to do now is talk a little bit about some of the numbers of how big a problem diabetes is, and then talk a little bit about how it can affect your feet, and then talk a bit more about what we can do every day to maintain our feet and keep them nice and healthy, so that our quality of life can stay nice and high and we can do all the things that we want to do, okay? So basically there are 4 types of diabetes. Type 1 diabetes, that develops at a younger age, and that tends to be more due to genetic factors. They're still not quite sure why type 1 diabetes happens. They're thinking it might be viral infection or something else. But it tends to happen in younger age groups, but adults can still develop type 1 diabetes as well. There's pre-diabetes. Now this is what we refer to as like a glucose intolerance. So basically you're sitting on that borderline and your sugar levels are a little bit elevated, but it's not classic diabetes at that point in time. And then that leads on to potentially type 2 diabetes, which tends to happen as we get a bit older. It happens if our lifestyles are a bit more inactive, if we're eating too much of the wrong sorts of sugars and foods and things. And then gestational diabetes, which tends to happen to mothers that have a predisposition towards this condition, and usually with big babies as well. So there are a number of other diabetes as well, but they're more associated with specific medical conditions. So these are the 4 predominant types of diabetes that we encounter in society. So we're going to focus a bit mostly on that today.
What are the chances of pre-diabetes developing into that?
The best answer to that is it depends. So if you're diagnosed as being pre-diabetic or having pre-diabetes, and you do nothing to change your lifestyle, your diet, your exercise levels, then your chance of leading to diabetes is quite high. If you have pre-diabetes and you make some major changes to your life and get back to eating really healthy foods, keep exercising, increase your step count, all of those things, then your chances of that settling down are quite good as well. So it really depends on whether you heed the messages of, okay, pre-diabetes is like a warning flag. It's like someone waving a red flag saying, hey, we've got to change something here. Otherwise, you're more likely to develop problems and complications further down the track. So what you put in is what you get out at that point in time, I would say. Same thing with anything, you know, you can go to the gym and do your exercise class, you can sit there and go, I'm done. Or you can put the effort in, get strong, that's it. There are some days I feel like that, but yeah. But it's the same thing with any of these medical conditions. If you put the effort in to make the changes that you need, then your chances are really good of actually preventing these things from progressing. So let's have a bit of a look at the numbers in Australia, particularly about diabetes in relation to feet. So there's around 1.8 million people in Australia that have diabetes. Now I didn't look up how many people we have in Australia. It's about, was it 50 million or something?
28.
28. That's a large proportion of people in Australia with diabetes. So that's quite a confronting number, I find. 280 people develop diabetes every day in Australia. That's one person every 5 minutes in Australia will develop diabetes. So this is a big problem for us as a country, I think. And the numbers globally are pretty much similar with this as well. So percentages are quite high all over the world. Yeah.
Has this got something to do with the way our diets have changed over the last 50 years and the amount of medication that people are taking these days, which affects our body as well?
I can't speak to the medication side of that, but definitely the diet side of things. If we look back 40, 50 years ago and we look at the foods our grandparents ate, it was smaller proportions, it was good healthy fruit and vegetables,
Yep.
small bit of meat, and that was about it. Good.
And non-processed food.
That's right, yeah.
Okay.
Whereas today we have all of these processed foods that are available to us, and to make those foods enjoyable, they chuck in a bunch of sugar, or they're simple carbohydrates that convert to sugar very, very quickly, or they're high fat, or these sorts of things. And they're quick and they're easy, so people get onto those things. If we went back to a more healthy diet from 40, 50 years ago, that would probably help us quite significantly. But diet is a big, big problem for us in Australia, I think. And if you speak to the dietitians and your GPs, they'll all say, cut back on these sorts of foods, eat simple foods, eat, good fruit and vegetables, increase that content, and that's going to make all of us better, I think. But the dietitians are probably the best people to talk to, but definitely diet is a huge contributor to diabetes. 2.4 million people are affected by diabetes every day. Now, this number is about people with diabetes, but also people that their diabetes are going to affect. So it could be a family member, it could be the workplace, it could be children. All of these, it's not just the people with diabetes that have the effects of diabetes, it's the people that care for them, the people that work with them. The numbers get bigger and bigger when we start to look at how diabetes affects society in this situation. So this top number is just people with diabetes, but this number is those people around them that are having effects because of that person's diabetes as well. And then the total cost and impact of diabetes in Australia is about $14.6 billion per year. And that's healthcare, that's costs to the health system, that's losses in workplace time, it's family costs. All of these things impact on Australia as a society. So, I mean, that's a huge number, 16 billion. That's lots and lots and lots of zeros at the end of that. So if we can have better control of diabetes, minimise the people that are developing diabetes, we then prevent the complications, we prevent the hospital admissions, we prevent all of these problems from developing long term. So this just shows why diabetes is such a big problem for us. So diabetes is a big problem in our community, in our society, but what is it about diabetes that creates a problem for the feet? So we're just going to talk a little bit more about that now. The two main areas as podiatrists that we find diabetes has an effect on in your body in relation to your feet are the nerves and the flow of blood to your feet as well. So if we look at the nerves in your feet, nerves detect sensation, they activate movements, they control body functions. So all of these things are vital to have your feet moving and functioning properly, as well as your whole body. The interesting thing just to remember is there are no pain nerves. There are no nerves that detect pain. I find this fascinating. Pain science is really, really quite incredible. So the way that pain works is that the body responds to sensations. So for example, you put your hand onto a hot plate. The body registers that heat, and then it sends all that information to the brain, where that information gets processed to determine whether that source or that sensation you're getting is a risk to you. Now pain, think of it as a risk score. So if you've got a little bit of pain, that's the brain saying, oh, that's a little bit of risk down there to your body. It might cause some damage. Be aware of that. When you get a lot of pain, that's your brain saying, oh, I don't like that. Something bad's going on down there. You better pay attention to it and deal with it. So pain levels can go up with the degree of sensation you're getting at that source. It can go up because of the way you're feeling, your emotional state, history, all sorts of things. But there are no specific nerves in your body that detect pain. But all of these nerves are detecting a whole bunch of other things as well. So when we start to lose that nerve function, that's why pain is reduced, because the brain isn't getting the information it needs to tell whether that stimulus is a risk for you or not.
So Anthony, if there are no pain nerves,
Yep.
how is the sensation moved into your brain?
It's still through the nerves, definitely. So there are we'll go on to talk about that in a moment. Talk about that a bit more. So there are nerves that detect heat. There are nerves that detect fine touch. There are nerves that detect movement. There are nerves that detect damage to the skin, so cuts, scratches, and all of that information about movement, heat, fine touch, all of those things are what the brain processes to determine whether that's a pain sensation. Does that make sense?
It does.
It does, yep. So nerve damage or a condition called neuropathy can develop when you've got increased blood sugar levels in the body. So increased sugar in the bloodstream can cause a lot of damage, and with nerves it damages the insulating sheath around the nerve that allows the electrical impulse to pass through to the brain. It can damage the nerve itself, and it can damage a whole lot of other structures. But if the nerves are damaged, they don't work properly. Think of an electrical cable. If you've got a happy, healthy electrical cable, the electricity runs through that cable quite nice. If there's damage to the conducting sheath around the outside of that cable, then the electricity might spark off somewhere else and you might not get the flow through there. And the same thing happens to nerves. If you have a sensation down here that sparks an impulse through your nerve, but that nerve is damaged, that impulse may not get to your brain, so the brain can't process what's happening at the extremity. Does that make sense? Yep. And this is what we see happening with diabetes. Because of those elevated sugar levels, those nerves get damaged, so they don't function as well as they should. And then that can lead to this condition called neuropathy. So nerve changes decrease the feeling in your feet. So for example, I've seen clients in the clinic with diabetes and nerve damage who have trodden on a pin and haven't felt that happen because that nerve sensation doesn't work. And they've walked into my clinic and go, oh, what's that? I go, what's what? And I go, there's something in your foot, and you've pulled out a pin, and they go, oh, I didn't know it was there. And that seems, I mean, you sort of think, well, how can that be? Surely you can feel that. But this is what diabetes can do. It can change the level of perception through these nerves so that you don't actually have that feeling or sensation underneath your feet. So you can get a loss of pain sensation in your feet because if those sensory inputs from the feet aren't getting to the brain can't process whether that is a risk for you or not, so your pain levels are reduced. Pain is an important part of our protective mechanism. If we get damage, we need to know that damage is there so we can treat it, the tissues get healthier, and we're not at risk of infection or further problems down the track. But if we lose that ability to process that sensation and determine that pain, we don't know what's happening, and then we can develop other problems because of that as well. And that just basically leads to an increased risk of unnoticed damage, which is a big problem when it comes to diabetes. You think about going for a long walk, getting a blister on your foot, you go, oh gee, that hurts, and you have a look, you do something about it. If you don't feel that sensation of pain and you've got a blister on your foot, you won't treat that. Then you can get an infection, then that infection can spread, then that can become more of a problem for you. So allowing your body to know when something's wrong at your feet is vital for keeping us healthy. Some people, however, with diabetes, it's not about losing sensation. When the nerves are damaged, sometimes you're still getting those sensory inputs to the brain, but the brain is getting a different message, so it doesn't know what to tell you basically. If you're not getting enough sensory information to the brain, you lose the feeling of pain. But if that message is changed, the brain might go, oh, that's weird, I better make you more aware of that. So some people with diabetes actually get an increase in pain levels because their nerves are damaged or their nerves are changed. So then some people can actually get a hot, tingly, painful foot because of the nerve damage, and that's what we call a painful neuropathy. So you can get a neuropathy where you get a loss of sensation, or you can get a neuropathy where you actually get altered sensation and the foot doesn't feel right. And I've had clients explain this like, it just feels like I've got this burning, prickling feeling in my feet all the time. Some people describe it like they've got ants crawling on their skin all the time as well. But it's just because the nerves are damaged and they're sending a different message to the brain now rather than what the brain should be receiving. Does that make sense? Yep. You can get skin changes. The nerves control the health of a lot of our tissue structures like the skin, the bones, the muscles. And if the nerves that control perhaps the moisture producing glands in your feet don't work properly, you're not going to have those nerves telling those glands to produce moisture anymore. So suddenly the skin becomes a lot drier. So we often see people with diabetes with very dry, brittle skin, which can then lead to cracks and infections and problems like that as well. And you can also get joint changes. The nerves control the muscles. If the nerves aren't telling the muscles to work, then the muscles aren't supporting the bone structures, and we can actually get collapsing of foot structures or changes to the way the feet work. Some people will develop clawing of the toes, which then get rubbed from shoes, and that can cause problems as well. Okay, any questions about nerves and how they work in the body?
I like the analogy that you made with the electrical cable.
Yep.
So really you're saying you've got an electrical cable and the elevated levels of sugar are going to eat away effectively at the insulation around the cable. And so then in exactly the same way as an electrical cable being bare and so it's against a fluid, then that electrical power is going to go into that fluid rather than going in the direction it should.
Yeah, the electrical stimulus or impulse gets lost, basically. So the function of that doesn't work. If we want to go and get really complex, there are different nerves are constructed slightly differently. There are some nerves with that sort of insulation cable around the sides of them. There are nerves without that as well. And they all detect different things. But high sugar levels, basically, the most important thing to remember is it damages nerves. So it reduces the function.
If you stub your toe,
yep,
you get a lot of pain. Where's the nerves? How come the nerves?
Well, there are...
telling you that there's pain.
Yeah, because there are nerves in your body that detect pressure. There are nerves that detect skin damage. There are nerves that detect bending. So all of those nerves detect that sensation of your foot or your toe hitting the solid chair. Then they send that impulse to the brain, and then the brain says, oh, that's quite a bit of damage. I'm going to create pain down there so that you're aware that you've done some damage there. So without that impulse getting to the brain because of the damage with diabetes, you'll know you've kicked it, but you won't know the degree of damage that you've been left with at the end of the day. And that's the big problem. If you don't understand or you don't know the degree of damage, you'll just go, oh yeah, that was okay, and you get on with life. But you may have ripped the nail off of your toe in that situation, but have no sensation of that, and so you don't do anything about it. And that's where we get into trouble with diabetes. Yeah. So the other major change that we see with diabetes is changes to the flow of blood in the feet. Now, blood flow keeps bones, muscles and skin healthy. It moves oxygen about the body. It helps to fight infection by moving all the good cells that fight infection into the feet. And it helps to repair damaged tissues, getting nice, healthy, oxygenated blood down there. So once we start to get damage because of the blood flow not working properly, we start to have problems with feet there as well. So damage to the blood flow of the feet, this is called peripheral vascular disease. Peripheral meaning far away and vascular being blood flow. It can occur with increased blood sugar levels. Poor blood flow to the feet can cause many, many foot problems. And if you've got nerve damage as well as poor blood supply, that really increases your risk of problems as well. Because if you don't know something's damaged on your foot and the flow of blood is not getting down there to heal that up quickly, things take a lot longer to heal and you can be more at risk of infection, and these problems compound all the time. So with blood flow changes, we get delayed healing. So I've noticed as I've got older, things don't heal quite as well as they used to. When you're a really young person, you know, you get a cut or a scratch and it feels like the next day it's all healed up. So as we age, our healing can be a little bit slower. But if we've got poor blood supply, that healing takes much, much longer than what it would normally do. So reduced blood supply slows down the normal healing process that we all go through. We talked earlier about blood flow helping to reduce risk of infection by bringing on all those lovely cells that fight infection. So if you've got reduced blood flow, infections can build up and develop much more quickly than what they would normally do. And if the flow of blood's not great, infections tend to get bigger, they spread, they get into other parts of your foot or your lower leg as well, and that's where we have a lot of problems developing with diabetes. We need that good blood supply to heal up any tissue as quickly as we can and to fight any infection or bacteria that might be down there. There's an increased risk of ulceration. Now, we'll talk a little bit about these sorts of foot problems in just a minute. Foot ulcers are a big problem with diabetes, and they can be caused by a lack of feeling in your feet or poor blood supply. Now, a foot ulcer basically is a wound that hasn't healed properly. So for example, if you fall over and you take a bit of skin off your leg, normally that heals in maybe 3 to 4 weeks quite happily. If that wound doesn't heal, that's what we refer to an ulcer basically. Now, feet are very much at risk of developing ulcers because if the flow of blood's not getting to the foot, then that wound doesn't heal, which then causes more tissue breakdown potentially, and it can cause an ulceration. So the longer the ulcer or the wound is there, the more chance of infection has of developing, which then puts us more at risk of foot problems. So there's a risk of gangrene. Gangrene is basically where the skin dies back because it's not getting enough blood supply. Fortunately, this isn't something that happens a lot these days. We've got great surgeries to improve blood supply, medications, all these sorts of things, but I have still seen people with gangrene develop because their diabetes has damaged their blood supply so badly. So the whole point about what we're trying to do today is to just sort of educate people to say, hey, if we look after our feet and do the right thing, we can minimize these risk factors, and that's really what we want to do as much as we possibly can. And cold feet. Anyone here get cold feet? I get cold feet and fingers all the time. Cold feet is just a sign that the flow of blood to your feet is not as good as what it should be. It's the warm blood flow moving through our skin that keeps our body nice and warm. So if you're feeling cold in the fingers or the hands, it's often because that flow of blood's not as good. The body's very clever. What it wants to do is it wants to maintain your core temperature as close to that 37 degrees as it possibly can. So if it detects that you're getting, if it detects that the environment is cold, it doesn't want blood flowing to the tips of your fingers and toes where it can chill, because that chilled blood would then come back and lower your core temperature. So what it tends to do is it just slowly reduces the blood flow to your extremities to maintain your core temperature. But the problem with that is that the less blood flow you get to your fingers and your toes, the colder they become. So the body goes, oh, it's still cold, I better shut that blood flow down a bit more, which makes them colder, which means less blood flow, which makes them colder and less blood flow. So this cycle can build up. That's why sometimes it's easier to keep your feet nice and warm rather than to let them get freezing and then try to warm them up again. And as podiatrists, we talk a lot about trying to maintain a good temperature around your feet rather than getting them through the cycle of hot and cold and hot and cold and hot and cold. So circulation changes makes your feet a lot colder just because you're not getting that warmth circulating around as much. Skin changes as well. Blood flow is important to keep all the glands and the structures in your skin healthy. So we tend to find that people with skin change or circulation changes can have much drier skin, and it becomes quite brittle and fragile as well. So keeping the blood flowing helps to keep the skin as healthy as we possibly can. And some people can get cramps. If you're walking and you're developing cramps in the back of your calf muscles, that can be a sign of poor blood supply to your feet as well. And it's not so much if you're laying in bed and you get cramps or anything like that. It's when you sort of walk maybe 10, 15 metres and suddenly the calves really cramp up. That can be a sign that there's a reduction of blood supply to those muscles. Muscles need oxygen to stay healthy and to keep functioning. If your muscles are cramping up with just a little bit of activity, that's a sign that maybe we should get that blood flow to those areas checked out. So I've taken some numbers from Diabetes Australia just to look at how Australian feet with diabetes affected. So more than 27,000 people are being admitted for diabetic foot ulcers each year. That's a lot of people. That's a big number. And that means these people have had significant damage to their feet because of their diabetes to develop a foot ulcer, which may then get infected, so much so that they need a hospital admission to manage that. 27,000 people. There are more than 4,400 amputations every year because of diabetes. Now that number is bigger than any other reason of amputations, basically. Now, amputation is a treatment of last resort. We have great antibiotics, great surgeries and things that can help people with problems in their feet. But if someone has developed an infection that is spreading into their leg that threatens their life, amputation is sometimes the only treatment available to that person. So once again, this is why we focus on minimising risk of diabetes.
Yes, I'm aware of that as a reality because a close friend of mine has lost both feet
Yeah,
as a result.
yeah,
And he has class 1 diabetes.
yeah. It's a terrible thing.
Yeah.
Yeah. And you think about that from, well, I think about that from change that person's life now. And you know, everything changes. If you've had something major like this happen, you need so much more help at home. You know, for someone who's older that this happens to, that could mean a nursing home admission. That can be a complete change of life. But if we do the initial steps to try and minimise the risks of diabetes, you know, changing our lifestyle and things, that can help us prevent these sorts of things from developing.
One thing it didn't do was change his mindset.
Yeah.
He's still as funny as ever.
Yeah, that's good. Yeah. And you know, these sorts of things don't have to change us, but they have a great capacity to make a big difference in our life. More than 1,700 people with diabetes die because of foot ulcers and lower limb wounds every year. That is too many, way too many. You know, these are, most of the time, these are preventable complications. So if we can do the right thing and look after ourselves and get the right help, these things don't have to happen. You know, I don't mean to put these numbers up to scare people. This is, for me, this is always a good reality check. This is what the real risk of diabetes in your feet really is. And 8% of all diabetes-related deaths are a direct result of foot ulcers and lower limb wounds. So once again, that was just a 2005 number, so that was 15, 17 years ago, so that number is probably very different these days as well. And diabetes foot-related disease costs around 1.6 million every single year. So this is how much the healthcare system is spending just on foot-related diabetes problems. They're all really big numbers, you know, they're not small numbers, they're not insignificant numbers. And I guess as a podiatrist, I still see these numbers and I still get shocked that, you know, these things are still a massive burden on us, our families, the people we care about. So as a podiatrist, I'm always thinking, what can we do to change it? So this here, what we're doing today, this education, this is about how we can learn to do things differently as well. And if you can go out and share that information with other people, that makes a big difference, I think. And the good news, sorry, lots of bad news in there, so let's talk about some nice, simple, good things that we can do. So this is our 6 steps to amazing feet when you have diabetes. Number 1, look after your diabetes. That's key, that's the most important thing. Effectively managing diabetes is the best way to prevent diabetes-related complications. All of the research tells us this. All of the studies tell us this as well. I always put this one up here because most of us are very happy to run towards pills and surgery, but the lifestyle change window is fairly empty most of the time. And diabetes certainly, especially type 2 diabetes, is a disease of lifestyle for a lot of people. It's not eating the right foods, it's not being active. And let's face it, our society these days is more about being inactive than it is about being active. Even when I was a kid, you know, you used to have to get up and change the channel on the television. Or the adverts would come on and you'd go out. I don't know. Or the adverts would come on and you'd go off and walk and do something. Now you sit there on the couch, click, 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 oh, fast forward the advert, or I'll binge watch this entire series. So everything around us is making us more and more inactive. So we have to make a choice to visit the lifestyle change counter once in a while to help improve our health. And if people like yourselves are coming to places like this where they've got these great gyms and these activity programs, that makes a huge difference, huge difference. So really, it's about having as healthy a lifestyle as we possibly can. You know, there are always times where we're going to be sat down on our butts for a while, that's just life in general, but it's all the things we do every day, that 5 or 10 extra steps to do one activity, making the choice to come to a gym and be a bit more active. These things make a big difference, and this is how we minimise the effects of diabetes. Number 2, checking your feet each day. I always recommend twice a day, morning and night. Twice a day basically means we check them in the morning, and you check them at night to see if something's changed. If you've lost the feeling in your feet with diabetes and you don't check your feet, you won't know if something's wrong. If your nerves aren't working, you have to use your eyes to see if there's been damage to your feet somewhere. So morning and night, that way you know if there's any difference. Takes 10 seconds, if that. Quick check, everything's fine, let's get on with life. Step 3, keeping your feet healthy. Wash, dry, clean socks daily. If the skin has less bacteria on it and you accidentally get a cut or a scratch, you're less likely to develop an infection. If we're reusing our socks or we're not keeping the skin clean and healthy, you've got more risk of infection. So a simple thing like keeping the feet clean and healthy minimises that risk. And when you think about it, if you're standing in the shower washing your body, where do all the bugs end up? Gravity has a way of making them end up on your feet. So at the end of the shower, give them a quick wash.
Actually, I remember as a child, my parents taught me when I come out of the bath or the shower, to make sure I dried between my toes.
Yep.
And
Yep.
Yeah, make sure they're dry.
Yep, absolutely. If you don't dry between your toes, the moisture builds up, you can get cracks and splits, then you can get bacterial infections, fungal infections, whole range of problems. So that one simple action of drying your feet properly minimises the risk of skin damage, minimises the risk of infections. So looking after your toenails, toenails need to be cut the right way. You'll notice throughout life your toenails can change, whether they're becoming thicker or whether they become a little bit more curved in or more ingrown. So what we used to be able to do when we were 20 may not be the same as what we can do when we're 70, 80 or 90 or so. So if you need help, get help. Podiatrists are trained to manage very difficult toenails. So if you're struggling with nails, getting a little bit of help can be a way that we minimise risk. I've seen far too many clients who come in and say, oh, I had a go at cutting my toenails and now I've cut a piece of my toe off. It happens. I mean, I've done it once or twice myself, I suspect. But when you've got diabetes with poor circulation and poor nerves, how are you going to know you've done that damage? apart from if you get a bit of bleeding there. I've seen far too many clients end up with toe ulcers and wounds because they've cut a part of their toe, they thought it was okay, and let's face it, without my glasses I can't see very well in certain spots. So if you don't see it happen and you don't feel it happen, you may not know it's happened. Step 5, wear shoes. But more importantly, wear the right shoes. Shoes act as that first line of protection. A lot of people love barefoot walking, and that's fine if your nerves are working correctly. But if your nerves aren't working correctly and you've got bare feet and you tread on something sharp, you're going to do some damage. If you've got 5 or 6 millimeters of hard rubber or polyurethane between you and the ground, that shoe will get damaged and your foot won't. So having shoes on all the time when you have diabetes is the first step to protecting your feet. But they've got to be the right shoes. They've got to fit your feet. They've got to be the right shape for your feet. They have to be appropriate for what you're doing in them.
Do you need a small heel on the shoe? Or
That's,
proper?
yeah, most of the time a little bit of a heel, 10, 15 mil or so. Foot structures are different between person to person, and some people need a slightly bigger heel, some people need a slightly lower heel based on the shape of their foot. And that's certainly something podiatrists can help with by assessing the shape of your foot to see what sort of footwear is going to be most appropriate for you. But having the right shoe on means you're going to minimise that initial risk of trauma, which then leads to all the other potential problems moving forwards. Number 6, have a regular checkup. Depending on your level of risk, so depending on how much damage you've got to nerves or circulation, we usually say 6 months or less. So what we do as podiatrists is we assess the nerve function, we assess the blood supply, we assess the structure of your foot, the shape of your foot, what your toenails look like, your ability to look after yourself, and we determine then a risk score of low, medium or high risk. Low risks means you don't have any complications and you can get about your life quite happily. Medium risks might be 1 or 2 complications that just increase your chance of developing foot problems. High risk means that you've got a lot of risk and you've got a lot of chance of developing foot problems if things don't go well. So if you know what your risk of problems are, then you can start to adjust your lifestyle a little bit to make sure that you're incorporating all the protective mechanisms you need to minimise the problems developing around your feet. So how can we help? At Complete Podiatry, our core purpose is to help build amazing lives from the feet up. So for us, we want to empower people to understand how important their feet are so that they can make great choices and changes to their life and their foot care to ensure that their feet are with them for the rest of their life firstly, and that their feet don't stop you from doing all the things that you want to do. Healthy feet allow you to be functional, happy people. That's really what it comes down to. And we do a lot of hands-on skills. We use a lot of technology at our practice as well. We do diabetes assessments, needling, mobilisation, strapping, electrical nerve stimulation, massage. All of these things can help in certain situations to keep the feet functioning at their optimal level to enable everyone to do what they want to do. We utilise a range of special treatment options to get people out of pain, so shockwave, laser foot scanners, fungal nail lasers. We've got special microwave treatment for skin lesions. We do blood flow assessment, wax therapy, ingrown toenail bracing. An ingrown toenail doesn't sound like much, but an ingrown toenail can lead to an infection. And if you've got diabetes, that infection can put your toe at risk or your foot at risk. If that happens, then you may need to lead to an amputation, which then changes your life, which changes everything. So something like an ingrown toenail may not seem like much, but in the situation where you've got blood flow changes and nerve changes, it can be a huge life-changing thing. Most people don't know that podiatrists are only one of 3 professions that are allowed to perform surgery on the human body. Doctors, dentists and podiatrists, we're the only ones that are qualified to use local anaesthetic and perform operations. So we do ingrown toenail surgery, ganglion cyst drainage, wart needling procedures as well, all under local anaesthetic. And a big one for people with diabetes is nail and skin care. It's a really simple way that we can keep people nice and healthy if we manage nails and skin. So fungal nail and skin infections can be an issue, ingrown toenails, thick nails, it makes them hard to trim, so people squeeze harder on the nail nippers and can potentially slip. difficulty in caring for nails, just reaching nails. We all get stiffer as we age. That's just part of life. And so these toes down here seem to get further and further away. That's just the way it is. And I've found myself that with my glasses, my focal point's weird. So with my glasses on, I can see here perfectly, but down there it's not so great. But with the glasses off, it's not so great down there, but it's terrible up here. So sometimes feet are just at that awkward distance between our focal points. So we're great long distance and we're great here, but that middle distance can sometimes be a problem. Corns, calluses, wounds, cracked heels, these are all things that we as podiatrists can help with. Orthotics, every time your foot hits, I'll start again. People don't realise how orthotics actually work a lot of the time. People think they're arch supports, they lift your arches up, those sorts of things. It's not quite how they work. Every time your foot hits the ground hits back with an equal and opposite force. That's just physics. Now, depending on how your foot functions, the bone positions, the structure of the bones, the muscles, the tendons, that force of your foot hitting the ground can be okay, or it could be loading something in your foot too aggressively, which then could cause damage, which can cause pain. So many foot and leg problems are caused by these damaging forces, and by putting an orthotic between you and the ground, we can change how your foot receives that force, and we can take force away from damaged tissue and move it to somewhere else that's better able to deal with that force. So orthotics change the way that forces affect the feet and thereby the rest of the body. The human body is what we refer to as a kinetic chain. So as we hit the ground, that force hits the foot first, and then it can affect the ankle, then the knee, then the hip, then the back, and then further up that kinetic chain. So if the foot is not managing that force properly, we can have problems further up the body as well. Does that make sense? I love my physics, so I can get really, really into that if you want to, but it'll probably bore you senseless. And there's so much more. Podiatrists are like general practitioners for your feet. You know, we spend years at university just looking at feet and legs. So diabetes assessment, strength and conditioning, education support, foot, leg, hip, back pain, and so much more. This is where we can help people live a better and more amazing life just by starting at the feet and working our ways up. Yeah?
Are all the podiatrists the same, or are they trained different?
We're all trained the same, but I guess what we do after university is probably more important. So university sets us to a minimum standard so that we're qualified to work with people as a foot healthcare practitioner. What we do from that point on, I think, sets different people apart. We invest a lot in technology and education. We have monthly education sessions just for our podiatrists in the clinic. We do a lot of stuff to train ourselves with as many skills as we can, because we want to be able to offer our clients as many options as we possibly can as well.
So some will go into specializations.
Some podiatrists become surgeons, yep.
Please excuse me, but I have a 12 o'clock engagement in the city.
No worries.
I've got to go.
Yeah, absolutely.
This has been fantastic,
Oh, good.
and I'll put the word out.
Fabulous. Well done. Thank you very much.
No, thank you.
I'll give you one as
He's
well.
my chauffeur, I better go with
You
him.
better go as well. Thank you very much.
We should do more
Yeah,
between this building and you.
absolutely we should. Yeah, definitely. That's what we're looking to do. Yes, so podiatry there are podiatrists that go on to specialise in surgery, just surgery, so bone surgery, bunions, toes, those sorts of things. Some podiatrists will specialise in diabetes, wounds, foot health, those sorts of things. We tend to specialise in general podiatry, so like being a general practitioner. Some will be a sports podiatrist, some will just focus on paediatrics or children. So yeah, people go to specialise, but most of us at Complete Podiatry, we like to feel ourselves as a generalist or a general practitioner for your feet, basically. So we cover a whole broad range of issues for feet.
And the way you tell is people look up
Yep.
and see what the specialization.
Yep, most podiatrists will be generalist podiatrists. If you're looking for more specialty stuff, then you probably have to look a little bit deeper, but most podiatrists can start you off with your diabetes assessment, they can start you off with foot health checks, orthotic devices, kids screenings, all these sorts of things, yeah. That's it, thank you.